A pet owner's guide to liver disease in dogs. Subscribe to our channel, and get notified for latest updates on videos like this. Many pet owners are aware of common canine health problems like ear infections, dental disease, and skin infections. But when our fur babies contract less visible conditions, like liver disease, it isn't always easy to recognize the symptoms. Yet, liver problems in dogs are quite common, with canine liver disease being listed as the 5th leading cause of death for man's best friend. For this reason, it is essential that pet owners become more familiar with the signs of liver disease in dogs, especially since early detection and prompt treatment are of critical importance when trying to protect your pup's life and ensure they live the longest, healthiest, and most comfortable life possible. The warning signs of liver issues in dogs includes: Number 1. Decreased appetite. Number 2. Vomiting or diarrhea. Number 3. Weight loss. Number 4. Lethargy or weakness. Number 5. Increased thirst. Number 6. Yellowing of the gums or the whites of the eyes. Number 7. Fluid retention in the abdomen. Number 8. Dark urine. It's important to remember that if your pet is suffering from canine liver disease, they may not display all of these symptoms or only display a handful. While these symptoms can be indicators of liver disease, they may also be indicative of other pet health issues. For example, urinary tract infections, kidney disease, and diabetes all share increased thirst as a common clinical warning sign. If you notice any of the warning signs above, seek immediate veterinary care. There are several different types of liver disorders that your dog could be affected by. Many of these disorders share similar symptoms, however, some do not. Thus, it's always recommended that pet parents seek medical attention for their pets if they notice any of the signs stated before, so an accurate diagnosis can be made. Cirrhosis of the liver. Liver cancer. Benign liver tumors. Hepatitis. Fatty liver disease. Leptospirosis. The liver is the largest internal organ in both humans and dogs, and is connected to an array of bodily functions. This means that when something is wrong with the liver, it can impact your pet's overall health in several different ways. Number 1. Congenital liver disease. Much like larger dogs that experience an increased risk of hip dysplasia and bloat, some breeds are genetically predisposed to liver issues. One of the most prevalent types of congenital liver disease is a portosystemic shunt. This occurs when a new pathway develops between a portal vein, which delivers blood to the liver, and another vein within the body, allowing blood to bypass or shunt around the liver. This causes major problems, since the liver filters the blood, and if your pet's blood is not being properly filtered, toxins and other substances may not be adequately removed from the bloodstream. Number 2. Infectious liver disease. This type of liver disease in dogs is brought on by viral, bacterial, fungal, or parasitic infections that make their way into your pup's system. These infections can cause the liver to swell, hindering its ability to perform its normal functions. Some of the most common infectious liver diseases in dogs include canine hepatitis, leptospirosis, histoplasmosis, coccidioidomycosis, canine herpes virus, Tisser disease. Number 3. Drug-induced liver disease. We all know medications for human consumption come with side effects that must be carefully considered, but it's not uncommon for pet owners to be unaware that their pups' medications can also produce adverse reactions. Many canine medications are known to impact liver enzyme levels, including tetracycline, acetaminophen, and anabolic steroids. If your pup has been prescribed a new medication, it is always a good idea to speak with your veterinarian about any potential side effects, especially if your pet already has a history of liver issues. Typically, canine liver diseases are categorized as either chronic or acute. A chronic liver issue, while still concerning, develops over a longer period of time and can often be managed with consistent, proper care. An acute condition, however, develops rapidly, and can have an irreversible effect on your pet's health. Acute liver conditions often lead to liver failure, where 70% or more of the liver's functionality has been lost. If liver failure occurs, your dog must be hospitalized immediately so professionals can administer colloid replacements and oxygen supplementation, along with a pharmaceutical regimen. The signs of liver failure in dogs include extremely high levels of liver enzymes, low blood sugar, ammonium urate crystals in the urine, bilirubin in the urine, abnormalities in blood platelets and coagulation or blood clotting factors, aggression, excessive drooling, blindness, seizures, jaundice. Many of the symptoms of liver failure in dogs are only detectable via lab tests and other medical procedures. If you suspect your pet may be experiencing liver failure, it is imperative that you speak to a vet. Share this to your family and friends. Make sure to subscribe and get notified for more videos like this. Thanks for watching.